Okay, so we're here with Abigail, and she has been on a journey to help soften up her birthmark here. And look at how gorgeous her face is. I mean, this is like perfection. I mean, your face looks so pretty. I was just looking at, and without makeup, you can look like this. But she is a stylist, and so, I mean, look at what she's done to herself. So if you want to get in contact with her, just direct message us, and we can get you in touch with Abigail. Now, you've done several treatments with this before, is that true?
I hear this is the 5th.
This is the 5th. Okay, yes. But you've done other ones in your previous life, yes. And another. Was it Colorado? Am I right, or was it?
I've done it in Texas, New York, Philadelphia at one point. So.
Mm-hmm. Yes, and you typically were doing V-beam. Is that correct?
I don't know.
Okay. Well, there are different lasers to treat port wine stains, and we have 3 things to treat red spots here in our practice. We have the XLV, which is this one. It's a 532-1064 laser. Then we have the V-beam, which is a 595 laser. And then we have the IPL, and that's a multiple wavelength, not a real laser. Now, the reason that matters is different wavelengths go deeper into the tissue. And so with you, we've been mixing it up, trying to make sure we get the superficial pigment, or not pigment, but blood vessels and the deeper blood vessels. So today, Todd, do you have the previous number that we used?
I do, and I sent you up.
Okay, and can we go up a little bit? Did you have any scabbing or crusting with the last treatment? Okay, so we're going to go up just a little bit. And with this device, what we have to do is we have to put a little bit of sliding gel on it. And so can I get gloves, please, Todd? Thank you. Todd actually is one of our nurse practitioners who does lasers. He's an expert in lasers and cosmetic, and he has other talents, but we can't talk about that on camera. Okay, so here we go. So here we go. We're going to try to not mess up. Is that Lululemon?
Oh, you can ruin this whole thing.
Oh, this old cute thing.
The stylist has her ways. You look cute, don't spend too much.
Oh, I love that. I need you in my life.
Hey, I'm here.
Do you style your husband as well, or fiance? Your fiancés right now, right?
Oh, I do. Well, we're getting there.
Does he feel like he has his own sense of style, and it's?
Oh yeah, but like that's what I do is I help it like match who he is, and so
I love that.
Of course, I know him the best.
Yes.
So, yeah.
Okay.
You can also have your goals of what you do want to look like.
Yes. Okay. So there's the glasses. Now, do you get people on a workout regimen as well and a diet plan, or is
that's like where I try to partner with other people who that's their specialty.
But I mean, do you recommend it for people?
Oh yeah. So I get to really learn their like personal or professional goals, and then giving them the image to match.
Right.
So if they're really wanting to attract a certain opportunity, and a workout's going to help them at the right diet, my big thing is how are you going to find confidence? So that's what I'm about. It's like, first of all, we can get you the clothing to look taller and leaner, but let's get you on the right diet plan to feel healthy, to chase after whatever opportunity you want.
Right. Well, I'm a huge fan that diet makes you look better and feel better.
Oh yeah.
I mean, just me. I'm leaning on you.
Oh, that's awesome.
Okay, so here we go. Now you're going to see there's just a bright light and a flash, and here we go. Whoops. It's going. Oh, well, that's because it's not on yet. I missed the flute. It has this really calming flute sound. There we go. Did you hear the flute sound?
Yeah,
it's beautiful. That means it's ready. I was so caught up in our conversation. Okay, so here we go. How'd that feel?
I can handle it. Just
Good.
a little.
If you need a little break, just let me know. And you can see with this device, it's just helping to coagulate those blood vessels so that they disappear. Ty, can you help me out with changing the setting? Let's go up just a little bit, 6, and then I want to do so it's repeating.
What are you looking for, doctor?
Just a little bit of a change so it lightens up a little bit. But we see there's been a little bit of purple going on there. Now you had some by your lip too that we wanted to get, didn't you?
Yes. It kind of goes underneath my nose all the way to the corner of my mouth.
Is that a little Texas accent we're getting here?
Of course, I got the southern drawl.
I love it. It's so charming. Reminds me of my days in the South. Okay, so now we got that, and then it's on the upper lip. Is that right? Right up here? Just sliding that gel over here. Sorry, we won't wake you up with this. Okay, so that's all there is to it. So we'll just have you back and take a look to get your final before and after pictures. And then we can also do the deeper 1064 at some point. Do you combine those ever together, or do you just do the 1064?
On something like this, because she has a purple to it, I would eventually go to 1064.
Okay, did you want to do a little 1064 on her, Todd, today?
If you'd like me to.
Yeah, I would like that. So we're gonna add the 1064 on, and Todd's gonna take over with that.
Can you say what device you just did?
This is the Cutera, and it's called the XCELV, and it's really a great laser. This one's really nice. The difference between this and a V-beam is the wavelength's a little bit different, but with the V-beam you anticipate bruising. With the XLV you anticipate with the V-beam you anticipate bruising and swelling. With this one you anticipate swelling. These are not no downtime treatments. Abigail, have you gotten bad downtime, some swelling?
I get a little swelling right afterwards, but it doesn't last. I mean, I'm great the next day.
Great. And so that's the big difference. They're both going to have some downtime. I think the V-beam is a little bit more aggressive. Now we're going to go to the 1064 and go very light on this because, this is the one that is the most sensitive. So, and have you used that on port wines before?
Yes.
And make sure you're very separated because we can't accumulate any heat at all. So very, 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 very light. So Todd's going to go with the deeper settings, and thank you so much for coming in. Always good to see you. I'm going to let Todd take over. Thank you. And Todd will talk about why this is happening.
Hear about Todd's talent.
Looks good.
I have the numbing cream on. I can't really feel anything.
Good. That's the way that we want it.
You're gonna. Because there are those deeper purple.
There are.
So that's the different lasers for.
It's the same laser, but it's a different wavelength. And when we talk about lasers, we talk about wavelengths and where it's going in the skin. And there are some ways that we can adjust that a little bit. For instance, with a Fraxel, if I increase the intensity over time, those little wavelengths, those little emissions of laser light are going to go deeper and deeper and deeper into the skin. With this one, what I'm trying to do is, but usually when you see the color purple on somebody with a port wine stain, you're thinking that it's very, very deep in the skin, and so to get rid of the port wine stain, you have to go deep enough to get the blood supply to the port wine stain. So it's you can tell on her that we have a little bit of purple right here in the center. Sorry, I didn't mean to scare you. We have a little bit of purple right here, and most of it's pink. The reason that I'm going to go very light on this is because we just treated her with a 562 or with a 532, so I don't want to burn her. That's the last thing that I want to do. This particular laser is an amazing laser. It's a top of the line laser for vascular issues like port wine stains or hemangiomas, those little tiny red dots that you have, the vessels around the nose. But the problem is you need to be able to understand how far you can go without hurting somebody, because burns can happen. And the last thing that I want to do is burn her beautiful face. So it puts all of the stress on me.
I have experienced in a past laser treatment the burn, and it was bad.
Yeah.
So I appreciate the sensitivity towards it, because
of course
it's not good.
And how long have you been on this journey?
Since I was 4 years old, and I just turned 32. So it's definitely been a journey. But when I was 4, I was under anesthesia, so not any memories.
I'm gonna bring you up a little bit higher so I'm not bending over the top of you. All right, 1, 2, 3. What?
Sorry, I didn't feel
I
a
lied.
thing. It's still-
I lied. You can't see anything on the computer over here with that's associated with the laser, with the glasses on.
No.
So it's just cooling this part of the laser cools down. So when it's on the surface of the skin, her skin will be cooled. Okay, 1, 2, 3. How are you doing?
That was fine.
Perfect. And what we can expect from this, because I absolutely don't want any overlap, what we can expect from this is little areas over time that start to rectify. They start to fade, and then you're going to see areas that you have to treat the next time. So this is not a one and done thing. This is going to, and as she said earlier, this has been a lifelong journey for her, and this is about making it better. It's not always about making it completely gone. Do you have any questions?
Oh, but you said it great.
Okay, perfect.
Thanks, Todd.
Thank you guys. Have a great day. Bye-bye.